Are you having pain or redness in your greater toes in your feet? It might be an ingrowing toenail. I am Dr. Sanjay Sharma, a podiatric surgeon practicing since the last 12 years in Bangalore. Ingrowing toenails are one of the most painful conditions that we see in the feet. It doesn't mean that ingrowing toenails are genetic or ingrowing toenails are due to cutting of the nail and other things. It happens because of various reasons. The first and the foremost reasons for an ingrowing toenail is the footwear that you have been wearing. Not today, but you have been wearing since your childhood. If it's a tight footwear that you have been wearing, which is keeping all your toes in your feet, pressed like this, the chances of an ingrowing toenail is very high. The other conditions could be some kind of a trauma that would be possible when you are playing or something like that, which could cause an ingrowing toenail, or the fungal infection of the nails, which will make your nail thickened, which will pierce into your skin and cause an ingrowing toenail. And there are several various reasons, but these are the most common reasons that we see. Ingrowing toenail is nothing but the nail is piercing into the skin underneath it or on the side of it. This is not a condition which can be treated medically. In the sense, no amount of a tablet or an ointment will cure an ingrowing toenail. Even though that it might cure temporarily, in the sense if there is an infection due to an ingrowing toenail, taking some antibiotics or putting some antibacterial creams might have seemed to have cured it. But the primary reason of an ingrowing toenail where the nail is piercing into the skin is not cured. So the only treatment that we have is a surgical option, and there are various surgeries that we can see for an ingrowing toenail, depending upon how frequently it is coming and what is the condition of the greater toe itself. The first and the foremost way to treat an ingrowing toenail is what we call it as a wedge excision, where we cut a small part of the nail which is piercing into the skin under a local anesthesia. And after this procedure, in about 14 days time, the toe will be completely healed, and we will teach you on how to cut the nail so that this doesn't reoccur once again. In spite of these wedge excisions, and if you're unable to cut the nail properly as we have trained you, the next step would be something called as a complete nail removal or nail avulsion, where we do not cauterize the roots, but we just remove the nail and ensure that the nail grows back properly. The third option is what we call as a Vanderbons procedure, or it's more of a plastic surgery, where if this is your greater toe that we see here, and this is the nail that it's going into the skin, we cut the surrounding tissue rather than a nail itself, so that the nail has no option to grow outside the skin rather than growing into the skin. The last but not the least treatment is the complete removal and cauterization of the nail matrix, where the nail will not grow any further. But most of the cases, we see that just doing a wedge excision of the nail and cutting the nails properly and not using a constricting footwear will solve this issue. If you find this information useful, please like this video and share this with your friends and subscribe to my YouTube channel.